Hello and welcome to Health Mantra. I am Mansi Fadnis, your host for this very special episode. Now just imagine losing all your teeth doesn't have to mean losing your smile forever. Thanks to Corticobasal Implantology, patients today can walk into a clinic without teeth and walk out in just 72 hours with a confident, lasting smile. And at the forefront of this transformation in India is Dr. Laxman Malkunje, Maharashtra Ratna Awardee, recipient of the Excellence Global Healthcare and Wellness Award, and one of the country's most trusted names in implantology. With over 2,000 full mouth rehabilitations to his credit, Dr. Malkunje has dedicated his career to restoring not just teeth, but confidence and quality of life. After completing his training at King George's Medical University, Lucknow, and advancing his specialization in Corticobasal Implantology with training in Munich, Germany, he now leads one of India's most advanced implant practices right here in Pune. Through his work at the 72-hour Smile Care Center, Dr. Malkunje has proven that world-class implantology is not only possible in India, it is changing lives every single day. So joining us today is the man behind thousands of restored smiles, Dr. Laxman Malkunje. Doctor, a very warm welcome to the show.
Thank you, ma'am. Thank you so much.
So, Dr. Malkunje, right off the bat, we would like to know what inspired you to start this, and if you could explain to us what the unique features of 72-hour Smile Care Center are.
See, what happened? Whenever there is a pain in the tooth or there is a tooth loss, first of all, patient think that now how many times I have to visit my dentist and how much pain I have to bear during the treatment or how many cost I have to bear. So to reduce this anxiety and fear, we decided to form a center, that name is the 72-hour Smile Care Center, where almost all the dental treatments are completed within 72 hours with the advanced technology, with trained staff and state-of-the-art equipments. So we decided to deliver all the smiles within 72 hours. Do you know, in the conventional implantology, when there is no tooth, patient have to visit more times to the dentist and within the long span like the 4 to 6 months. But with the corticobasal implantology, we can give chewable and smiley teeth to our patient within 72 hours.
Right, that's extremely fascinating, doctor. But now, for our viewers, let's try to help them understand what exactly this is. So in simple terms, could you explain to us what corticobasal implants are and how they are different from conventional implants?
Yes, as the name suggested, what happened, there are two types of bone. One is the cancellous bone and one is the cortical bone. In conventional implantology, we use the cancellous bone, in which we place the implant. The cancellous bone have the more blood supply, more prone to infection, and it can't bear the load. So we have to wait for at least 4 to 6 months. As compared to the cancellous bone, cortical bone is very strong. It is resistance free. Again, it is infection free, and you have less blood supply, and it can bear so much of load. So we place the implant at the cortical bone and the buttresses. So we can give the chewable teeth to our patient within the 72 hours.
Right. So, well, that's the science behind it. And thank you so much, doctor, for demystifying that for us. But let's try to understand what does it actually look like in process. So, tell us about the treatment protocol that is involved here, right from when the patient first arrives at your clinic to when they walk out with that smile of theirs.
It's having the 3 pages. The pre-surgical phase, in which we do the investigation like X-rays, blood reports, fitness of the patient. Once we do all the things, then we give the date to the patient for the surgical phase. On day 1, if there is a teeth, we extracted that teeth and put the implants. And if there is no teeth, we didn't take any flap, we didn't do any sinus surgery, we didn't do any bone grafting. We just place the implant in the cortical and then we take the measurement. On the day 2, we do the tying and the JR. And on the day 3, we fix the final teeth. So on the day 3, patient can chew the food. This is the surgical phase. The most crucial phase is the last step, that is the follow-up. The patient must give us follow-up for the next 3 to 6 months. That is also important stage.
Right, absolutely. Well, that's quite a journey in such a short span of time, I must say. But I'm sure the viewers are also wondering who can actually go for this treatment, right? So tell us who this is beneficial for, who specifically does this corticobasal implants apply to, and more importantly, can patients with pre-existing conditions like diabetes or high blood pressure, or even people with smoking habits, can they opt for it?
It's a good question. So many patients heard that from the dentist that don't have the bone or your jaw is the atrophic bone is there. But with the corticobasal implantology, we can place the fixed teeth in this atrophic jaws or the insufficient jaw bone. So every patient or each and every patient can be treated with the corticobasal implantology. Also, these implants are designed as the smooth surface implant. So we can place this implant in the diabetic patient also, heart disease patient is also, and also in the smokers also.
Right.
So there is no criteria that it can't be placed the corticobasal. In each and every case, you can use the corticobasal. There is the age limit is there. The lower age limit is 18 year. Below 18 year, we can't place the implants in conventional or either corticobasal. There is no upper limit. If the patient has the willpower, we can place implant in at any age.
Right. So, well, that certainly clears a lot of doubts for us. So, thank you for clarifying that. But, one may wonder what next after this process, right? So, once a patient receives this basal implants, what aftercare or precautions can they ensure for the longevity of this treatment to last?
For the success of the corticobasal implantology, two things are more important. One is the operator skill. Operator must be skilled or must be trained. And second one is the follow. What happened once the patient got the teeth, they didn't come to us after that. It must not happen because the follow-up is most crucial part. Is it? We have to check the occlusion after 15 days, 1 month, 3 months, 6 months. See this follow. In this follow-up, we also taken care of see the oral hygiene of the patient. We always ask our patient to give follow-up, chew from the both side, do the oral rinsing. That is most important for the successfulness of the corticobasal implantology.
Right. And like you very rightly said, doctor, that a lot of people don't take follow-ups that seriously, but especially in this case, I think to ensure longevity, aftercare is absolutely important, and that also means that follow-ups are as important as the actual surgery is. But, there's yet another term that keeps coming up when we talk about corticobasal implants, that's immediate functional loading, right? So one of the highlights of this technology is immediate functional loading, correct me if I'm wrong. But could you explain what this means and why is it such a benefit for patients?
See what happened in conventional implantology. Whenever there is placement of implant, after 3 to 4 months, we have to give the teeth. For this 3 to 4 months, patient can't chew food. He's only on the liquid diet. So her physics or his health was not proper. But with the corticobasal implantology, we have to give the chewable teeth within the 72 hours. So he can chew the food after the 72 hours. So the benefit is that he can chew food and he get the more healthier life. Now, this immediate functional loading implantology, this concept is coming from the orthopedic science. What happened in the orthopedic science, whenever they are doing the nailing for the fracture on their femur or other bones, they always ask their patient to work on the second day. Why? Because bone always need to work. If bone doesn't have the work, then it get resolved, it get infected.
Right.
So to keep healthy, the bone always need the work. So this science came from the orthopedic science that we have to give the work to the bone.
Right, absolutely. Now, well, doctor, let's keep science aside for a minute here because actually what actually stays with people are the stories. So could you share some memorable success stories of a patient who has walked in and has had a life-changing experience with basal implants?
I treated so many cases, but few of cases are very close to my heart. One of the girl is 18-year-old. She is having the ectodermal dysplasia disease. There is a less bone and quality of bone is also low. This case was rejected by most of the dentists in our city. Then she hear my name, she came to me. I treated that patient. I give the chewable and smiley teeth within the 72 hours. And I saw she's so much happy. And at that time, I feel proud that I can give her smile.
Yeah.
Another case was that the man who is a 93-year young man, because he wanted teeth at the 93 year. I also told that if you have the mental health is good, na, you can you can have the teeth at any age. So that case was also very near to my heart. Another one lady, she is having pyrethia, that is the periodontal disease. She has loose tooth, halitosis is there, but she don't want to without teeth for the 3 or 6 months. So I told her, this is the Corticobasal Implantology. You no need to wait. We just place your implant and give you a smile within the 72 hours. And she was so happy after the 72 Corticobasal implant and smile after the 72 hours.
Well, doctor, thank you so much for sharing that, because I do think that such kind of support is absolutely essential logistically and medically for patients who are coming from outside of Pune. But before we resume our conversation, we'll take a short break here and we'll be right back. Welcome back, everyone. So, doctor, before the break, we were discussing heartwarming success stories that you shared with us. But the other side of surgery is also anxiety and fear amongst patients who are undergoing this treatment. So, what reassurance or advice would you give to these patients?
See, tooth extraction is a very tricky procedure in the dentistry. The most pain of the things are we involve having during the tooth extraction. But in the dental implantology, it is very simple procedure. There is no any flap, no any bone grafting, no sinus surgery, so no any surgery. We just have to put our implant. So it is well assured that there is no surgery, then there is no pain. Okay. Then again, the dentist's domain skill was also must be good, that he or she can do the hassle-free or pain-free treatment to their patients. It's our duty to give the painless treatment to the patient. As a surgeon or basal implantologist with the experience of 12 to 13 years in this field, I find that hardly 1 or 2 patients have the pain or swelling or other things with my patient. We always care of our patients, like giving the post surgical instructions properly, give the proper medicine, give the proper follow-up. So there will not be any pain after surgery or during surgery also.
Right.
So it's a painless procedure than the tooth extraction.
That's very, very reassuring, doctor. And very few doctors can actually do that. So thank you so much. But I think the best thing would be to actually listen to one of the patients speaking to us. So let's listen to their testimony.
Hello, I'm Dr. Mrunalini Chaugule and she is my mother, Mrs. Alka Chaugule. So she was having oral issues since very long time. We came here at 72 Hours Clinic to meet Dr. Laxman Malkunje to get to know about the further treatment. So we got the consultation done very well. Sir said that we can go ahead with the basal implant, which is a 3 days procedure. So on the first day, we went for the implant placement, which was very painless. And then on the second day, we went for the metal trying, which was also very painless. She didn't have any pain or anything. And on the very third day, she got her new set of teeth and she was ready to smile and eat properly. She was confident with her smile. Thank you so much, sir, for giving her the confidence to smile again.
Well, that was straight from the patient's mouth, and that was really, really nice to hear and see that smile on their face. But now, Dr. Malkunje, we have heard that you're not just spreading smiles in Pune, but across Maharashtra and also from different parts of India. How would you say is your staff supporting and aiding such patients logistically and medically?
When I established this center, a 72 Hours Smile Care Center as a brand, I also decided to start the dental tourism. Whatever you ask me now is like the dental tourism, in which patients can come from other parts of Pune, out of the Maharashtra, out of the India also. So my team is very professional and is a very kind team. Whenever we got a lead or call from our patients, team call them, ask them to do some pre-operative investigations like blood investigations, X-rays, intraoral photographs. They exchange on the WhatsApp. Then they discuss about the money, discuss about the what is the treatment protocol, how will you go, how much time we require. Then after that, we give them the appointment on some day or whatever the day fix. Then my team again contacted them and do their journey smoothly, like their travel arrangement is there, there's staying in the Pune, how to stay, then how they are preferably in the Pune. So this kind of treatment given by my staff. Also, after the treatment, we already explained that we need the follow-ups. So they always call them on the day by day, like after 7 days, after 15 days, 1 days, for the follow-up also. This is how the dental tourism work with us.
Right, right. Absolutely. But doctor, you spoke about cost, and that is one of the most common concerns that patients have, and especially when it comes to treatments that are fairly new to them. What would you like to tell them about the affordability of this treatment?
Okay. First of all, I am a dentist. So I always ask my patients, my neighbors, or my colleagues, or I taking different scams also for the patient, and I always ask them, ki do not lose your natural teeth. They are most prestigious, or they are the most important, because whatever the chewing power of the natural teeth, that cannot be gained with the implants. Okay, so whenever there is a mild pain or maybe there is caries, so always show to your dentist and they get the treatment as early as soon as possible. That means your natural tooth can be saved, because natural tooth is very important. But what happens when we lose the teeth by anything, then we have to restore that tooth. Because if you not restore that tooth, your chewing ability get disturbed, and it will affect on the digestion and or your health. So we have to replace that teeth as soon as possible. Okay, so obviously we are giving the best implants, we are giving the best material, so there is always need a cost for that. But think about that cost is not the wastage of money, it is investment in your health.
Right.
Because after you got the teeth, now you can chew properly, then your digestion will be improved, then your health will be improved. So it may take cost, but it is like an investment in your health.
Right, absolutely. But if you just had to compare it to conventional methods of implants, whatever the cost attached to it is, would you still prefer that people go for this? And as compared to that, what would you say is the cost benefit here?
See, first of all, after 72 hours you can chew. So you have the food that is chewable, and that could increase your health. So it is always an investment in health. And as compared to conventional or corticobasal, it is not like that this is the very high cost or this is low. It's like the same. But you have to choose, you want to teeth within the 72 hours, or you want to teeth after 3 to 6 months.
Right, right, absolutely. Thank you so much for clarifying that for us. Now, doctor, many of our viewers may not yet be aware of this very advanced dental technology. And I think that also calls for awareness. What are your thoughts on that? Do we need a much greater awareness around this? And personally, are you taking any steps to spread awareness amongst people regarding this treatment?
Yes, ma'am, definitely. Because nowadays there is upgradation in every field. Okay, there is also upgradation in the dentistry. There is also upgradation in the implantology also. So, for the patient point of view, we are doing the social media campaigning, like the Facebook, Instagram. There is my Facebook ID is there, the Instagram ID is there, my clinic ID is there, my website is there also. Also, we are using the print media is there. Also, I am taking so many webinars, lectures, or camps for my patient. So we aware the patient about this technology by this method. Then I am also upgrading myself with the field, in this field with the new era. Like nowadays there is a digital dentist is there. So I always attend the conferences. I do workshops with my friends also. I attended workshop also. Also, to aware my colleagues, dentists, I also taking webinars myself, giving lectures, giving workshops for them. Because whenever dentist or my colleagues get upgraded or know about the knowledge, they can aware their patients.
Correct.
So this way we can upgrade myself also, and I will encourage my dentist friend also to do the corticobasal implant, because within 72 hours you are giving the fixed tooth to your patient. It's the God-given gift to them, na?
Absolutely.
That's why I will do the awareness. Also, I am a consultant and very so many at the dental clinic. So I always inspire them to do this dentistry.
Right. So to sum up what you just said, Doctor, community building is key here.
Yeah.
And on that fabulous note, Dr. Malkunje, thank you so much for joining us here today, sharing your expertise with us, but also for the vision that you bring to this field. So thank you so much.
Thank you.
And to all our viewers, thank you so much for watching us, and see you in the next episode.